The lower extremity massage can be done as a standalone massage or as part of the full body massage. Most often the face-up or supine position is done after face-down or prone position. The side-lying position is included at the end to show how somebody that is pregnant or has had a surgery preventing supine and or prone position can have legs massaged. We start with prone position, demonstrated after client's back was massaged. Drape the client's leg that you will be working with and secure the linen so you can get as close to the attachment at the iliofemoral joint as possible. Many hip external rotators attach here as insertion points. Once linen is secured, you can roll up the sheet to expose more hamstring and hip to client's comfort. Start with compressions around the hip at the iliofemoral joint as shown. Compress with fists. Turn and twist the tendons attaching to femur at greater trochanter to release pressure and compression of the sciatic nerve that travels through the muscles down middle of leg, the gluteal medius, gluteal minimus, gluteal maximus, piriformis, superior gemellus, inferior gemellus attached to the greater trochanter of femur at this joint. It is mid-lateral to buttock on lateral edge. You can palpate it with fist and feel the bony prominence. You don't need to have skin exposed to compress the iliofemoral joint. Then work into the hamstrings of client. You can start with effleurage flat pressure or flat finger strokes to palpate and then get deeper into muscle belly with the thumbs using thumb stripping strokes. Here we are working the lateral hamstring muscle group of the biceps femoris and adjacent iliotibial band. Always do long strokes to relax client nervous system to start, then when you find adhesion lesions between myofascial and muscles, you can pin it down with thumb or elbow and use other fist or knuckles, or elbow to drag, twist, pull, dig, and so on to create more room for tissue to move and for circulation of arterial supply, venous supply, lymphatics, and nerve conduction. Do this to client tolerance as with all choices used from your massage tools and options for massage goals for client and alleviated peripheral nerve compression or improving range of motion or function to the muscles, relieving cramping, improving circulation, and so on. Use thumbs with fists to avoid personal space of client as moving along each square centimeter of muscle fiber in long direction. From insertion to attachment as close as possible, you can do 10 to 30 strokes moving inner to outer or outer to inner and repeat or mix it up and do middle inner outer, and so on. The long strokes are relaxing. If you were to do the same exact strip 10 to 30 strokes it could irritate client and the skin but could allow you to move to deeper layers of muscle along that strip of muscle, then circulate the blood and lymphatic flow superficial to area and region with kneading or petrissage or both. Kneading seeks to use fists to push the tissue into each other and can be faster than effleurage but slower than petrissage that uses flat fingers or palms to move fast to circulate blood and soft tissue fluids to distribute across the myofascial and muscle space to pull out and digest toxins in the parasympathetic state of restful relaxation and digestion of toxins, as well as vasodilation to show some blood flow flushing the tissues as red or pink in color that disappears when left alone a few minutes.
Work into the calf muscles to alleviate tension, aches from working out, stimulate blood flow from sitting for long periods of time, and for general relaxation, use same lighter effleurage palm strokes to deeper thumb and knuckles to get deeper into muscle fibers and myofascial adhesions. Pay attention to visual signs of DVT such as warm flushed red skin tone compared to other calf, heat, or hot to touch, pain when deeper pressure applied to middle of largest muscle belly of calf, and swelling. This is a local contraindication to massage, and referral to ultrasound or emergency department should be recommended under Suggestions for Assessment and Plan of Treatment of Soap Notes.
Then work feet after calves with acupressure on plantar muscle of foot if the client has sock on.
After massage of foot, do compressions on thigh and calf and foot over linen as you cover the leg up, and move to next leg prone to repeat.
For those clients that need inner and outer thigh work, have a firm body pillow nearby so that you can use for the side position for client. Have client turn on side and hold linen and top cover to prevent exposure of client. Advise client to place top leg over the pillow while bottom leg touching massage table is beside pillow. Tuck linen under bottom leg to drape it securely, then begin massaging the inner thigh, calf, and foot. This is a good way to get the adductors of thigh and medial calf. You can do massage work on the inner thighs after the calves if you prefer, and readjust the covers to expose more of thigh. Adductors while not giving your client a wedgie. The thigh adductors are hip stabilizers, and in pregant women the obturator nerve can be compressed and cause pain and weakness in the thigh adductors. Massage can help alleviate pain after working out and having acute onset pain following thigh adductor exercises. The side position also allows you to massage the inner hamstring, semitendinosus, and semimembranosus muscles deeper than if client is only prone for hamstring massage. Use thumb stripping of hamstrings and thigh adductors for deeper muscle work. For lighter work, use petrissage with flat fingers, palms, or fists for kneading of muscles. The semitendinosus and semimembranosus hamstring muscles cross the knee and attach on the anterior medial superior tibia, called the pes anserina. Mnemonic for pes anserina attachments is SGT for semimembranosus, gracilis, and semitendinosus muscles. When you are done with the bottom leg, work on the top leg that is bent and resting on the firm body pillow. You need to cover the client back up, then get the other side of the covers. Pull top cover over and take the linen overlying top leg and secure and tuck it under the top leg and pull up as high as comfortable to secure it for massage. Once top leg linen is pulled up and secured, to reveal more upper outer thigh to massage with lotion, you can roll up the linen and secure it in place. Start with lighter effleurage and then work into firm palm pressure, fist stripping, and thumb stripping. The outer thigh has the tight and dense iliotibial band, also called the ITB. It is tight in runners bringing their leg into extension and knee flexion repetitively and under various weight and resistance changes. By terrain and training, it tends to be tender, and if you start with deep tissue work here, even in clients who can handle very deep pressure elsewhere like the back, the ITB can be a region of body that those same clients cannot handle deep tissue. It is clinically significant in some knee injuries and attaches to the gluteal muscles and tensor fasciae latae at the upper hip down to the tibia on the Gerdy's tubercle having to cross the knee. It is made up of dense fibrous tissue and not as vascularized as the adjacent hamstrings and quadriceps muscles. Continue thumb stripping and palm pressure effleurage on ITB as close to origin and attachment, and then work into the lateral quadricep muscle. The side position allows deeper quad work into the vastus lateralis of quadriceps muscle. The side-lying position for outer thigh also allows the lateral hamstring to be worked, that is the biceps femoris muscle. The biceps femoris muscle crosses the knee and attaches onto lateral superior tibia on Gerdy's tubercle by the ITB attachment. It is involved in knee flexion. The vastus lateralis of quadriceps muscle is for knee extension. They do not contract at the same time. If you have a cramp in the hamstring, contract the quadriceps, and if you have a cramp in the quadriceps, contract the hamstring. While contracting, hold breath and contraction 10 seconds, then stretch the muscle not contracting. This is called physiotherapy for contraction relaxation antagonist contraction, or CRAC. Then when done with outer thigh, you can work the lateral calf where the peroneus longus and peroneus brevis muscles are located. These muscles are involved in foot eversion and dorsiflexion. They do not cross the knee, but do cross the ankle and have attachments on the metatarsals of the foot. The lateral head of gastrocnemius can also be massaged deeper in side position. The gastrocnemius crosses the knee and originates on both condyles of femur and attaches to the Achilles tendon on back of ankle. It makes up the calf muscle and is responsible for plantar flexion of the foot. It is a sign of upper motor nerve lesion of S1 nerve root when a person cannot toe walk and has what is called foot drop due to muscle atrophy and nerve supply loss to S1. The soleus muscles are deeper to the gastrocnemius and attached to the Achilles as well for plantar flexion, but do not cross the knee and attach to tibia condyles. When done with client in side position for massaging inner and outer thigh, cover client and request that client turn over to their other side while taking pillow out from under top thigh. Once client is turned over, tuck the firm body pillow under their top leg and massage their other inner thigh and outer thigh. You can choose to mirror and use outer thigh first, then inner thigh of bottom leg, or not. Here, we start with the top leg for outer thigh work, then we'll end with the bottom leg for inner thigh work. Go from lighter effleurage palm pressure, flat finger, and fist effleurage if preferred. Then work into deeper thumb stripping, fist or knuckle stripping. Try massaging as close to insertion of muscle to origin of muscle that is higher positioned. The muscles of our bodies start at higher positions and then insert on lower positions of the body. Doing so will be relaxing. If you find more tension or tight dense tissue or knots of adhesion lesions, you can try to break them up. If you want to, you can pin the tissue knot down with elbow and then drag and pull it apart with other hand to separate the facial coverings of layers of muscle, but all thigh muscles in this area are moving in the same direction. The vastus lateralis and vastus medialis oblique run different directions. Here, we are doing thumb stripping of the ITB and the lateral hamstring at the biceps femoris muscle involved in knee flexion. Now that we have spent a good 3 to 5 minutes on the outer thigh, we move on to the leg or outer calf for the dorsiflexors and evertors of foot laterally and the plantar flexors of foot in the calf muscle. Start out with lighter strokes and then work into the muscle belly and adhesion knots to pull them apart. Pinning along an adhesion of tight dense tissue, and taking other elbow or knuckles to pull and dig to stretch the fibers in a cross fiber direction against the grain. This technique will offer relief and will not hurt the client as long as in a knot and not on bone. Goal is to pull apart knot and improve circulation and relieve peripheral nerve compression. The facial lining of these muscles can become very tight and limit natural glide of muscles onto each other and limit range of motion. Focus on removing a compression on a nerve that will be to keep the compression from forming again. This improves arterial blood flow, lymphatic circulation, and nerve conduction for a healthy feeling of relief of aches. When done with the outer thigh and outer leg on that side of body, keep client in that position. Then cover client's top leg and drape the bottom leg to expose the inner thigh and leg of bottom leg. We again work the inner thigh muscles of the bottom leg, starting with lighter effleurage flat palm pressure. The working up to the deeper strokes of thumb stripping or other preferred deeper massage strokes if client needs deeper tissue work. You can use petrissage and kneading to transition between body regions or to distribute blood and nutrients between myofascial layers of region worked deeply into. When finding the pressure that works, gradually add more to tolerance of client. This side position allows the adductors to be worked if they are aching, as well as the medial hamstring muscle group of semitendinosus and semimembranosus. The hamstrings flex the knee, and adductors add leg to midline of body and are involved in stabilizing pelvis above leg when standing on one leg. Then start with the calf of leg and massage with light effleurage palm flat finger strokes into deeper tissue work with the thumbs and thumb stripping. The side position will allow the medial head of gastrocnemius and soleus to be worked. Look for spider veins and see if the ache is in the middle of the gastrocnemius, because it could be a sign of a deep vein thrombosis or DVT. That is a life-threatening pathology of platelet clots that, if dislodged, can travel up the venous system to heart and pulmonary system and suffocate the client, or make it past that point and up the arch of aorta into the brain and cause a stroke. A DVT is a contraindication to massage and can be indicated by discolored skin, red and flushed, hot to touch, and swollen leg. These are usually on one side of body, so you can compare it to other side if you squeeze the calf muscle and cause pain as well, as give client shortness of breath or gasping for air and spinning sensation of room or double vision. It could indicate a DVT, and you should have patients see their emergency department as soon as possible. But it is not an immediate life-threatening emergency, as people live with them many years in some cases. If caused by post-surgical bed rest or long flights, then it is an emergency. Finish up the calf, go over the thigh again if you like, while end of the inner thigh massage and the end of lower extremity massage. And do some petrissage to boost circulation around areas deeper massage work was done.